Hello guys, welcome to another session. From this session onwards, we'll look at the different abdominal organs, right? Today we'll start with the abdominal part of the esophagus, right? Abdominal part of the esophagus. Abdominal part of the esophagus is only 1 to 2.5 centimeters long. That means it's very, in the abdomen, esophagus is very short. It enters the abdomen through the esophageal opening of the diaphragm, right? Runs downwards and to the left, in front of the left crus of the diaphragm and behind left lobe of the liver to end by opening into the cardiac end of the stomach, right? So esophagus opens into the stomach, right? We have left lobe of the liver, left crus, esophageal opening and all. We'll see. You see, this is the esophagus, right? This one is the esophagus, right? You see, so this one being the diaphragm, right? So this muscular diaphragm, we have esophagus entering through an opening, right? So that is called as esophageal opening, right? We have already seen that cursorily in the previous classes, the openings of the esophageal hiatus, it is called, right? So this is the right crus and this one is the left crus. Okay. This is the esophageal hiatus, right? Hiatus, right? Through this comes aorta, right? So this one being the right crus of the diaphragm and left crus of the diaphragm, right? Right? Remember that. And also I'll clear the diagram, right? So you see, only that part of the esophagus is abdominal part, right? You see, so this is the left lobe of the liver, right? So left part of the liver, we'll hide that. You see, so only very small portion of the this being the stomach, cardiac end of the stomach, right? So only small portion, that is the esophagus. That part only is the abdominal part of the esophagus. It just opens into the stomach and that's it, right? So it is 1 to 2.5 centimeters long. The esophageal opening of the diaphragm is situated at the level of T10 vertebra, slightly to the left of the median plane. The cardiac end of the stomach is situated at the level of T11 vertebra, about 2.5 centimeters to the left of the median. That means esophagus, right? Abdominal part of the esophagus is only from T10 to T11. That's it. Right? We'll see that. You see? You see, that is the T11 vertebra and this is the T10 vertebra, right? So actually esophageal hiatus is at the T10 vertebra, right? This must be at the T10 and cardiac end of the stomach must be at the T11. Thus, the abdominal part of the esophagus extends only from T10 to 11 vertebrae. Its right border it becomes continuous with the lesser curvature of the stomach, whereas its left border is separated from the fundus of the stomach by a notch called cardiac notch. Abdominal esophagus lies posterior to the left lobe of the liver and anterior to the left crus, right? We have already seen the relations. The left inferior phrenic vessels and the left greater vessels and lesser splanchnic nerves. Okay. You look at it. You see, these are the left gastric vessels, right? This is the left gastric artery and this is the left gastric vein, right? Now, sir, a little bit odd to see. This is the stomach, right? We'll hide again. This is the left lobe of the liver, right? So right border is continuous with the lesser curvature of the stomach, right? Let's see. So this is the lesser curvature, right? Lesser curvature, and this one is the greater curvature, right? This one. So right part is continuous with the lesser curvature, abdominal part of the esophagus, with the fundus of the stomach, right? So and it has vessels, left gastric vessels, and because it is related with the diaphragm, the phrenic vessels, right? Phrenic vessels also has relation with this abdominal part of esophagus, right? Its surface is covered by a thin layer of connective tissue and visceral peritoneum that contain the anterior and posterior vagus nerves. This is important. You have to remember that because esophagus it is covered anteriorly covered and posteriorly covered by peritoneum. In this peritoneal layer lies anterior vagus and posterior vagus nerves, right? As the esophageal branch of the left gastric vessels. The anterior and posterior vagus may be single or composed of multiple trunks. The anterior is closely applied to the anterior outer surface of the longitudinal muscle cord of the esophagus, while the posterior usually lies within the loose connective tissue immediately posterior and to the right of the esophagus, making its identification during surgery somewhat easier. See? So anterior vagi is almost unites with longitudinal muscle cord, right? So it's almost united with the esophagus, whereas the posterior lies within the peritoneum. Unlike the more proximal parts of the esophagus, the muscular wall of the abdominal esophagus is composed entirely of smooth muscle, right? So it is covered by peritoneum anteriorly and to the left, right? Posterior is related to the posterior vagal trunk because anterior it is related to the anterior vagal trunk, right? Posteriorly posterior vagal trunk, anteriorly to anterior vagal trunk, and left lobe of the liver. Esophageal branch of the left gastric artery and accompanying veins, right? The veins from the abdominal part of the esophagus drains partly into the portal and partly into the systemic circulation. You have to remember this. The veins drains into the portal circulation through the left gastric vein, right? And into the systemic circulation through hemiazygous vein. So some veins drains into the left gastric vein, which drains into the portal system, whereas some veins drains into the hemiazygous veins, directly into the systemic circulation. So this one is the portocaval anastomosis. Abdominal esophagus is effectively tethered to the margins of the muscular esophageal hiatus in the diaphragm by the phrenoesophageal ligament. You have to remember this, right? Phrenoesophageal ligament. Again, it has some two components, right? We'll look at that. You see, so phrenoesophageal ligament, right? And here again you see phrenoesophageal ligament. So this is the ascending limb and this is the descending limb, right? Ascending limb is in the blue color, descending limb is in the pink one. See, descending limb, right? So this part being the esophagus. This is stomach, right? So stomach is different from esophagus, right? So this squamous epithelium is, this is columnar epithelium, right? Stratified columnar epithelium. So these, whatever the epithelium it may be, so this is the transitional zone, right? So this is called as Z line. Esophageal and gastric. So the mucosa of esophagus is different from that of the stomach, right? So this is the Z line. So this is the phrenoesophageal ligament, right? You see left gastric artery and vein, right? This is the abdominal part of esophagus. So it is a vein. So some veins drains into the left gastric vein, right? So see, is the fundus. So left border of the left side of the abdominal esophagus is continuous with the fundus of the stomach, whereas the left one is continuous with the lesser curvature, right? Coming to the anatomical, applied anatomical points. The lower end of the esophagus is one of the important signs of the portocaval anastomosis. We have seen that in portal hypertension due to cirrhosis of liver or whatever may be the reason, when there is portal hypertension, the portocaval anastomotic channel open and becomes dilated and tortuous, forming esophageal varices. Right? Their rupture may cause severe and fatal hematemesis. Hematemesis means vomiting of blood, right? So because of the portal hypertension, there is hypertension in the portal system. Because of that, the hypertension is reflected in the esophagus, especially in the abdominal part of the esophagus, because there is portocaval anastomosis, right? So the veins of the abdominal esophagus become tortuous, right? So if they are ruptured, right? If they are ruptured, there will be a fatal hematemesis. It is a medical emergency, right? That is called as esophageal varices. Coming to the achalasia cardia, due to neuromuscular incoordination, sometimes the lower end of the esophagus fails to open and does not allow smooth passage of the food, leading to dysphagia called achalasia cardia. So this is entirely because of the neuromuscular incoordination. You see, you have seen the Z line, right? So at the cardiac end of the stomach, where the esophageal part of the abdominal part of the esophagus opens into the stomach, it may not allow the smooth passage of food, right? Marked dilatation of the esophagus may occur due to accumulation of food within it. The lower end of the esophagus is prone for inflammation and ulceration due to acidic regurgitation from the stomach. Okay, the lower end of the esophagus is the commonest site of carcinoma. So, in the esophageal carcinoma, the lower end is the commonest site of carcinoma, and also it is usually prone to inflammation because of the acidic regurgitation from the stomach, right? So that being said, that's all about abdominal part of the esophagus, right? So let me know if you have any doubts, right?